Hello. Yeah, you're welcome to our class today, and we're going to continue from where we stopped. Quickly, just to refresh our mind on where we stopped, and we have currently looked at the different systems in the body, uh, both the cell, the organ, the tissue, and the systems. So, so we mentioned the integumentary system. The integumentary system talks about the skin. So take note of the 5 functions of the skin. The skin acts as a barrier. The skin also is responsible for homeostasis, maintaining of the body chemical system, prevent water loss, regulate body temperature. It's also responsible for sensory responsibility, secretory and excretory. So just take note of these. On the skin, you have the different layers, the upper layer, you have the epidermis, the dermis, and the fat layer. So you have the upper, the middle, and the lower layer. Okay, so under the integumentary structure, you have the skin, there is your hair, there is the nail, there is the glands, and there is the nerves. So let's look at the lymphatic system. We've already discussed the lymphatic system, that the lymphatic system is responsible for, just a minute. Okay, so we have the lymphatic system, and that's the immune system. Okay, so this is responsible for the immune system. The immune system is responsible for defending the body organs and defending the body structure. And with the lymphatic system, the body is able to produce hormones into the bloodstream, which are able to help in fighting infection. So the lymphatic system is very important for the maintenance of the body integrity. So you have the lymph node, you can have the lymph node, the neck here, the lymph nodes are there. Then you have the waist region. So you notice that sometimes when you see sick people or when you fall sick, if you press this region, you'll be able to feel when you press here, you'll be able to feel a node. Okay, that's the lymph node. Our immune system are very, very good at their job. I mean, there are 1,001 microorganisms that are flying around every day. Your immune system is always working to protect your body from being cut down by these microorganisms. So when a person comes down with diseases, it's mainly because some of these organisms has been able to prevail over your immune system. Okay, so just take note of this, the lymphatic vessels, this is the cervical lymph node, the adenoid, the tonsils, the thymus gland. So these are the endocrine system, the lymphatic system. They are responsible for your protection. Okay, the bone marrows secrete the blood, white blood cells that fight against microorganisms. So we look at the reproductive system. The reproductive system helps for reproduction, for recreation. Uh, okay, so reproductive system is mainly for reproduction. Okay, so it allows the production of offspring. So in the reproductive system, you have the ovaries, you have the uterus, you have the mammary gland, that's the breast, you have the penis and the testes. Okay, so their function is to keep ensuring that human beings continue. Okay, so it's built mainly for the survival of species. After all, a species whose member couldn't reproduce will not last very long. So a species that this member cannot reproduce will definitely go into extinction. So in human beings, we have two very different reproductive systems. In some organisms are hermaphrodite. A hermaphrodite has both the male and the female reproductive system in the same organism. But in human beings, it's different. So in human beings, you have the males are separate in a man, and female organisms separate in a female. But in some organisms, you have the organism having both male and both female and reproductive system. So the human beings, we have separate one, the male system. The male one function of that is producing sperm and also finding the mate. And the female system produce the egg and also the womb. Okay, the womb is the organ of incubation. So and it also prepare for pregnancy, for childbirth, for baby care, for reproduction to be successful. So the women reproductive system is more complex. Okay, the female reproductive system is particularly fascinating to study the way the body system work together to ensure survival. So throughout of a human month, there's a human monthly cycle where the eggs are produced, where the eggs are matured, where the eggs are, destroyed, and okay. So there are some hormones that are involved in this system. So those hormones are produced by the ovaries, okay, and they decide when and whether her body is ready for pregnancy. So we have the major effects of the reproductive hormones on the reproductive organ themselves. They bring the egg, they produce the egg. So when the sperm and the egg meet together, they form the embryo. They nurture it. There is the uterine linings, rich in blood vessels, and so that's where you have all the supplies. Okay. Now, another important thing you need to take note is that other effects are also seen in other systems. Now, as a woman's cycle progresses, her hormone may affect her body temperature. So the hormonal changes in the female affect her body temperature, affect her mood, affect her responses, affect her attractive to the opposite sex, and ensure that the right resources, okay, right internal resources are made available for the embryo to be sustained and for childbirth. Okay, so the impact of the hormones go beyond the sexual reproduction. It even affect habits. Okay, so women can eat sand, or some can eat wood. Okay, so what happens is that the hormones affect a lot in the person's emotional and in the person's feeding behavior. Okay, so just take note of this. So we have the male reproductive system, and you have the female reproductive system. So these are the seminal vesicle for nutrition of production of the sperm, the prostate gland. Okay, then this is the penis. Okay, so this is the scrotum, and this is the urethra for urine. Okay, so this is the female reproductive organ. You have the uterus, the uterine wall, you have the fallopian tube, the ovary. The ovary is where the eggs are produced. Then you have the cervix, you have the vagina. Okay, so this is the male and female reproductive system. If you take note, you find that both of them are entirely different. What these have is different from what this one have. Okay. So take note of today's assignment. Okay, we are going into the pharmacology of some pharmacological study right now. So take note of this assignment. First assignment is with a detailed diagram discuss the pathophysiology of pain and inflammation. Then discuss the mechanism of action and side effect of a given NSAID and a neuropathic drug. So can you take note of this assignment? So you're going to use diagram, then you're going to discuss the pathophysiology of pain from the initiation to the communication and co. So your number 2 assignment is you're going to discuss the mechanism of action and side effect of a given NSAID. NSAID is non-steroidal anti-inflammatory drug. Yeah. So you're going to discuss an NSAID, choose one and discuss. Then choose a neuropathic drug and discuss. Okay. So we're going to look at inflammation from the word inflame. Pain, as we know, everybody has felt pain. Okay, something must have caught you, something must have choked you, something must have injured you. So what is pain? Pain is an unpleasant sensation, an emotional experience that is linked to a tissue damage. So for there to be pain, there is a tissue, a cell or a tissue is damaged. So when it's damaged, there are lots of chemical responses and chemical stimulations, which will now result to you feeling pain. So what's the necessity of pain? Pain allows the body to react and prevent further damage. The good thing about pain is this, that when there is a tissue damage, if there is no pain, the person may not even take note. Then there will be further tissue damage. Okay. But the good thing is that with pain, the body can respond, the body can react, then it will reduce further tissue damage. So people feel pain when a signal travels through the nerve fibers to the brain for what interpretation. So when there is an injury at a point, then there will be the production of chemicals and other neurotransmitters. Then there will be transfer of nerve signal, okay, through the nerve fibers to the brain. Then the brain will do what? The brain will now interpret. As the brain now interprets, now the body is now instructed to take an action, mostly to take a contrary actions, an action like escape, okay, or removal from that point of injury. So when we have pains, pains are classified into different classifications, but we're going to focus on two. Overall, pain can be classified as neuropathic, nociceptive, or psychogenic. Okay. So take note of this. It can be neuropathic, nociceptive, psychogenic. But overall, pains are classified into two. They are classified into either neuropathic pain or nociceptive pain. Okay. So now, further classification is the pain is classified either as acute or chronic pain. So an acute pain is just a pain you feel, okay, at the moment, maybe something just hit you and you feel that pain, okay. Then when they're over a period of time, the pain begin to ebb off. A chronic pain takes a long duration of time. An acute pain can last within 1 or 2 weeks, but a chronic pain will last for several months or several years. So pain was through nociception. Nociception is a process of pain, the communication, and it involves information transfer peripherally. Peripherally means from the surface. So on your surface, okay, there are nociceptors, which are receptors that are in the tissues. So when there is a cough, when there is an injury, what happens is that these nociceptors will now take the information, okay? So they will take the information from the tissue, the peripheral point, then they will communicate it and through the body, and they will transfer it to the brain. So when it gets to the brain, the nerve signals is decoded, the nerve signals is interpreted, then the nerve signals is what sent back, okay, to the point where the pain originated. Okay, maybe it's the hand, maybe there's a you just use your leg and you just match a nail. Okay, when you match a nail, what happens is that the nail will tear the tissues of the body. When the nail tear the tissues, what happens is the nociceptors, which are the pain receptors, will be impacted. So they will take that information and send to the brain. And when they send to the brain that there's an injury, there is a threat to this body, then the brain will now interpret and send to your leg. Then your leg will now realize, there will be signal realized and transduction. Then the person will remove the hand or the leg or whatsoever from the point of injury. Okay. So just take note of these. Pain are classified mainly into two. Please take note of this. Pains are classified into two. One is nociceptive pain.
Hello, sir. Give me.
Okay, good. So I'm sorry for that. I was mistakenly muted by at the background. So we mentioned that we have two kind of pain. We have the neuropathic, we have the nociceptive pain. So we are going to look at them one after the other. So let's start with nociceptive. As we mentioned earlier on, nociceptor is the process of pain communication. Okay, so nociceptors are receptors that are found on the surface of the tissue. So nociceptive pain is a medical term used to describe the pain from physical damage or potential damage to the body. So for nociceptive pain, there is a potential damage, something happened. Okay, something caused the tissues of that place to be harassed or to be torn. That's for nociceptive pain. So example of nociceptive pain is like you feel injury, maybe you are playing football and somebody injure you, you hit your leg on the floor, or you have your cooking and you cut your finger. Those are nociceptive pain. Okay, or they are having a dental procedure or even arthritis. So these are nociceptive pain. But neuropathic pain is caused by damage or disease affecting the somatosensory nervous system. Now, so in the nervous system, you have nerves that are very small, okay, that you can't even repair surgically. They are very, very tiny, microscopic. So whenever there's a damage on these nerves, it leads to neuropathic pain. Neuropathic pain is terrible. In neuropathic pain, it comes in different form. Okay, the person may be feeling burning all over him. Sometimes the person will be feeling as if ice block is on him or her. Sometimes the person will be feeling as if he put his leg inside fire or inside nails. Okay, so neuropathic pain, okay, is not like nociceptive pain where you have a physical injury. So it's associated with abnormal sensation called dysesthesia or pain from because dysesthesia means no pain, or non-painful stimuli. Somebody can just touch you and you start feeling pain. That one is called what? Analgesia. Okay, abnormal sensation called dysesthesia or pain from normally non-painful stimuli. Okay, so dysesthesia means when something that should cause pain is bringing excessive pain. That's dysesthesia. Allodynia means when something that ought not to cause pain is causing pain. That's allodynia. Okay, is that somebody touches you? When somebody touches you, should not cause pain. But in people that have sick disease condition, when somebody touch them, it can cause them very serious pain. Okay, so please take note of this: allodynia, dysthenia. It also may have continuous pain. Okay, that's paroxysmal. So take note of these components of neuropathic pain. So neuropathic pain, as we mentioned earlier, is a chronic. Neuropathic pain is chronic. It's not that can be chronic or acute. Acute pain, as I mentioned to you, is something between 2 weeks and thereabout. Chronic pain is something that is going to last for long. Okay, can last for years, can last for months. So neuropathic pain are severe chronic pain due to damage to sensory nerve. This is not because tissue have an injury. Take note of that. In nociceptive pain, a tissue have an injury. But in neuropathic pain, it is the sensory nerve that have an injury in the inside. Okay. So it can occur due to nervous system disorders such as stroke. When people have stroke, they can start having neuropathic pain. When people have diabetes, they can start having neuropathic pain. Okay, multiple sclerosis can cause it, or even malignancies, amputation, diabetic neuropathy, or following an infection like herpes zoster or shingles. Okay, after people have had that infection of shingles, they can start having neuropathic pain. Okay, so the mechanism of neuropathic pain is not like nociceptive pain. It is not well understood. Okay, so as I mentioned earlier on, they can be described as burning, shooting, or scarring pain, and the drugs they use, the licensed drug for it is pregabalin or gabapentin. But again, people keep to be using different things, like transcutaneous electric nerve stimulus. Okay, people can also use intravenous infusion of lidocaine or ketamine under specialized supervision. But generally, the licensed drug for neuropathic pain is pregabalin or gabapentin. Okay, opioids can also be used for neuropathic pain. So let's look at the word inflammation. Inflammation takes root from the Latin word set afire. So what's an inflammation? An inflammation is a local physical condition in which a part of the body becomes reddened, swollen, hot, painful, especially as a reaction of what? Injury or infection. So take note of this. When there is inflammation, the body swells up and the body is red. Let's say somebody hit you, okay, or even somebody cut you, okay, you find out that that place will swell up, or somebody box you, that place will swell up, the place will be hot, the place will be red, and the place will be painful. Okay, so it's a reaction to injury or infection. What's causing that inflammation? What's making that place red? The red blood cells, the white blood cells, they all run to that place, okay, to see if there are bacteria or whatever that is causing it, for them to destroy and kill. Okay, so that's why that place is red. So this just the inflammatory pathway or the pain pathway. So when you have a painful stimuli or site of injury, so this like the hand at the periphery and there in the hand. So this is, so there is the peripheral nerves at that point. Okay, so those information is taken to the peripheral nerve. There is A delta nerve, there is C fiber nerve. What happens is, as those pain informations come, they will be transferred to the dorsal root ganglion. Okay, relaying of the, what happened is this, the signals, the pain signals are transferred, then they are transferred toward the spinal cord. The spinal cord is responsible for transmission of pain signals. Then they are now transferred towards thalamus, that's in the brain. The thalamus is responsible for perception. Okay, so take note of this. The work of the thalamus is for perception. The work of the spinal cord is for transmission of pain signals. The work of the dorsal root ganglion is to relay nociceptive signals or information. So, and the work of the AC fiber is just to transfer sensory signals from the side of the stimulus to the to this other place. But at the end of the day, everything gets to the thalamus. Okay. So this, we have the ascending pathway. This is the ascending pathway from the pain stimulus to the nerve to the dorsal root ganglion to this spinal cord to the thalamus. So ascending pathway. Okay. So the descending pathway, this is a descending pathway. It will descend from the thalamus to the spinal cord and, okay, to the dorsal root ganglion. Okay, and when you get there, it will descend to the point of injury. So when you get to the point of injury, then you are instructed by the body to remove. So for pain, let's look at the mechanisms of pain causation. So now, when there is injury, the body stimulates different neurotransmitters and chemicals. It's those chemicals that are, they're actually trying to ensure blood, there's no much release of blood again so that the person doesn't die. That's why when you see there's an injury, we tie the place with clot. Why is it clotting? The body brings different chemicals, okay, to make that nerve to be tight so that blood will not be going out, except that injury is much, okay. So this is it. So there's membrane really lipid is released. There's arachidonic acid. So you have things like chemicals like leukotrienes, prostacyclines, thromboxanes, and prostaglandin. Okay, so now when you give a drug, what the drug does is to cut somewhere here, bind to some of these receptors, especially prostaglandin. So when they bind to prostaglandin, there is a less likelihood that the pain is coordinated downward. Okay. So let's now talk about analgesia. Analgesia simply means without pain. So we have drugs we call analgesics. They are drugs that are commonly used to remove pain. Okay, things like paracetamol and co. These drugs are called analgesics. Okay, so they are divided into peripheral and into centrally acting analgesics. So this just tells you where these drugs are. Paracetamol will act in the brain, morphine will act in the spinal cord, neuropathic drugs act in the spinal cord, and morphine can also act at the site of trauma, like the skin. Okay, so please take note of these peripheral acting drugs. We have, remember we said that the analgesic, we have peripheral acting and we have centrally acting. So for peripheral acting, you have things like aspirin, paracetamol, ibuprofen, fenprofen, naproxen, diclofenac, methamphetamine axis, peroxicam, tenoxicam, indomethacin. I know everyone here may have in one or two ways, taking one or two of these drugs. Okay, so this side you read it off. This is just telling you the choice. Is it first line? Is it for mild or moderate pain? Is it for pain alone, or is it for pain and inflammation? So non-steroidal anti-inflammatory agents, they are called NSAID. Okay, NSAID, they don't have steroid. Steroid is a chemical form. Okay, so anti-inflammatory agent that don't have steroid, they are called NSAID. So you have how do they act? They act by inhibiting cyclooxygenase. So they are called COX inhibiting enzymes. Okay, so when they inhibit COX, they inhibit prostaglandin, and so they will prevent pain. Okay, so you have an injury, that place is paining you, they'll give you drugs, they give you paracetamol or that. How now? All they do is to block these cyclooxygenase, which are responsible for causing the pain. So example is paracetamol, acetaminophen. Okay, is the most widely used medicine in the UK. Also in Nigeria is the most widely used medicine. Okay, now paracetamol is given 500 milligram. Okay, 2 tablets 3 times daily. So it should not be excessive use of paracetamol can lead to failure, renal failure. Okay, although it's a commonly seen drug, it can lead to renal failure. So we just look at centrally acting analgesic. Okay, and there's also analgesics that act on the central nervous system. Okay, centrally, so they can act in the brain. Example of them, they are called narcotics or opioids. So those drugs can, people can become addicted to it. Opioids and narcotics. Okay, um things like tramadol. Okay, they act centrally, but actually they are for pain, but they can become addictive. Things like morphine, things like opium, papaver somnifera, all those things, uh, they act centrally to stop pain, but they can become addictive. Okay, so strictly speaking, narcotics refer to the ability of a drug to induce sleep. So when the word narcotic was formed, the word narcotic is just to lead to sleep. Okay, but on the average, narcotic drugs, on a high dose of them, they can cause pain. Now, another thing about narcotic drugs is this, and when you're giving a narcotic drugs, you have to be careful, because at a high dose, they can cause the person to sleep, whereas the pain is still there. So on the average, if a pain can be managed using the normal non-steroidal anti-inflammatory drug, it is advisable rather than to use narcotic drugs. Okay, we are going to take questions. Okay, we just have 5 minutes to the end of the class, so I want to take questions at this point. Questions and comments at this point. Now I want to say something about so you can ask your questions. I want to say something about the assignment. Please, when you are giving assignment, I want to see that you are the one writing it. Okay, don't just send me, like somebody just send me a link. What will I do with the link? If I want to read up a link, I have 1,001 places to get information. So I want to see that you understand the assignment and that you contributed to the assignment. Yes, you can make reference to material, online materials. Yes, you can make reference to textbook, but let it be you that is writing it, not just copying an article and sending to me. Okay, so you can ask your questions now before we round up. So today, basically, we just talk about pain drugs. So next week, we'll be talking about endocrine and respiratory drugs. Endocrine and respiratory drugs. So do I have any question or any comment or any concern? Yes? Okay. Any question? Please, the students, have they been unmuted? Okay, so just take note of the questions again. The assignment, write a detailed diagram. For those that came late, write a detailed diagram. Sorry, with a detailed diagram, discuss the pathophysiology of pain and inflammation. So using a diagram, discuss the pathophysiology of pain and inflammation. Number 2 is discuss the mechanism of action and side effect of a given NSAID. As I mentioned to us, NSAID is non-steroidal anti-inflammatory drug. Non-steroidal anti-inflammatory drug and a neuropathic drug. Okay, you know, I've told us what NSAID are, and I gave us an example. I told us what neuropathic drugs are. Today, I gave us an example. So you are going to discuss one of them. Okay. So next week we'll be looking at endocrine drugs and respiratory drugs. Okay. So that's what we're going to look at. Okay. So any question before I round up this
Yes,
class?
please. I have a question.
Okay.
Good afternoon,
Yes.
sir. This is Amaka from Ecology Center.
Okay. Good afternoon.
Sir, please, I want clarification on the assignment. Should we make the diagram ourselves? And if so, how do we submit the assignment?
No, you don't. The diagram. Use a diagram. You submit it online. Okay. You
Uh-huh.
submit it to my email address. Okay. What do you mean by you? Will you make the diagram yourself?
Like, are we to draw the diagram ourselves? Then, if the diagram is drawn by us, it means I will just have to snap the diagram and send to your email.
No, you can use a diagram, an official, already drawn diagram, but you need to discuss with that diagram. Are you getting it?
Okay.
Okay. So I think
All
our
right.
time is up. This is my email address. I've sent my email address to you. Our time is up.
All
Okay.
right. Hello,
Just
sir.
check the chat format. You see the email address.
Hello, sir. Good afternoon, sir.
Yes, our time is up.
Yeah, this is from Microdi Center, sir. This is Omalade from Microdi Center, sir. Hello,
Molade,
sir.
our time is up. Yes.
Sir, when you are taking notes, you emphasize on the neuropathic and the other one. I want to know, is it under the classification of pain? Is it under it that we have the acute and chronic pain? The
Our time
neuropathic.
is up.
Hello, sir. What in the ọmọ ìgbà tó máa ń ṣèkàfù àti lẹ́tọ̀ ní tètè bẹ̀rẹ̀ tí tẹ́ẹ̀mù bá ti wá pọ̀ máa pariwo my time is up àwọn sì yìí kà ló máa ń ṣe wọ́n máa ṣe my time is up my time is up. 40 minutes. Another one. 40 minutes àbí. 4 o'clock ti lọ àbí abálájọ.